Okay, our next topic is going to be part two of dysphagia, and we're going to discuss Schatzki's ring, Plummer-Vinson syndrome, as well as Zenker's diverticulum. Now, Schatzki's ring is going to be a distal ring of the esophagus that's going to present with intermittent symptoms of dysphagia that is not associated with pain. It's going to be an episodic dysphagia, and it's going to have occurred for years in the patient. Okay, so think of an episodic dysphagia that has occurred for years. It's going to be intermittent and it's not associated with pain. This is going to be a distal ring of the esophagus, and it's going to be in the squamo-columnar junction proximal to the lower esophageal sphincter. And like we said earlier, everything in the esophagus, what are we going to do first? We're going to do a barium swallow, also known as a barium esophagography. Okay, our treatment, it's going to be dilatation procedures. You may also see pneumatic dilation, and this is going to be how we're going to look at the Schatzki's ring. Our next cause of dysphagia is going to be Plummer-Vinson syndrome. Now, when we said this is going to be a distal ring, Plummer-Vinson's is actually going to be a proximal stricture, and it's going to be associated with iron deficiency anemia with progression to squamous cell carcinoma. Plummer-Vinson's is usually going to occur in middle-aged women, and you're going to notice, you're going to see this, you're going to recognize this by the CBC usually. And our best initial therapy is going to be iron, obviously, because we're going to be iron deficient. But basically, we want to remember, once again, it's going to be in the esophagus. So what's going to be our first step? It's going to be barium swallow slash barium esophagography. So Plummer-Vinson's, remember, unlike Schatzki's, which is distal, Plummer-Vinson's is going to be proximal, and it's going to be associated with iron deficiency anemia and found in middle-aged women. And we're going to diagnose it with a barium, and we are going to treat it with dilatation procedures as well as iron replacement. Last is going to be Zenker's diverticulum. This is going to be false diverticulum, and it's only going to go through the mucosa and submucosa, unlike our true diverticulum, which is Meckel's. And this false diverticulum, this patient is primarily going to be presenting with the dysphagia, of course, with halitosis. They're going to have this fetid odor to their breath. And basically, this fetid odor is going to be because there's rotting food in the back of the esophagus in this diverticulum, because in the back of the esophagus, because there's dilation of the posterior pharyngeal constrictor muscles, and the food's going to remain in there. This is very, very proximal, and the patient's going to complain of having to repeatedly clear their throat, and they're going to wake up with undigested, regurgitated food on the pillow. I know that doesn't sound pretty, but that's how they're going to present it to you on the test. So remember, it's going to be dysphagia, like we said, with a really bad breath. I want you to think Zenker's, which is a false diverticulum. We never want to do endoscopy in these patients. Why? Because if we do an endoscopy or we place a nasogastric tube, it's going to perforate, or it's a very high chance of perforation. So anytime you see endoscopy or nasogastric tube in your answer choices, you automatically want to eliminate it in Zenker's, because there's a high chance of perforation if you use those. Now, you're going to see this usually in elderly, and of course it's in the esophagus. So what are we going to do? We're going to do a barium swallow or a barium esophagography, and our treatment is going to be surgical resection, and contraindicated, like I just said, is endoscopy or nasogastric tube. So our second part of dysphagia is pretty simple, and we're going to, let's go over it real quick again. Schatzki's ring. And Schatzki's ring is actually characterized by an intermittent dysphagia, and it's going to be episodic, and the patient's going to have had these symptoms for years. It's going to be more distal in the squamo-columnar junction proximal to the lower esophageal sphincter, and we're going to do barium, and we're going to treat it with dilatation procedures. Plummer-Vinson's is associated with iron deficiency anemia. It's more proximal. Middle-aged women, barium, of course, again, and dilatation procedures plus iron replacement. And Zenker's is going to be the person with dysphagia and bad breath. It's going to be very, very proximal. They're going to wake up with undigested, regurgitated food on the pillow. It's going to happen in an elderly patient. We're going to do a barium once again, and the treatment is surgical resection with endoscopy and nasogastric tube being contraindicated. And that's our second part of dysphagia.